Stop right there because what I'm about to tell you could save your life. Imagine waking up tomorrow knowing you caught prostate cancer before it ever had the chance to spread. Sounds impossible. It's not. I'm Dr. Edward Blake, and I'm here to show you how, if you know what to look for. The truth is, most men miss the earliest warning signs. Not because they don't care, but because those signs seem so harmless at first. A midnight bathroom trip here. A weaker stream there. Maybe an ache you blame on yard work. But those tiny changes are not random. They're your body's first whispers that something is wrong. And ignoring them is like hitting the snooze button on a ticking time bomb. Over the next few minutes, I'm going to walk you through 7 early signs your prostate could be in serious trouble, counting down to the single most urgent red flag you can't afford to ignore. And this isn't just a list. You'll learn exactly what each sign means, why it happens, and the one simple step you can take tonight to get ahead of it. So lean in, listen closely, because the sooner you recognize these clues, the more options you have, the less pain you'll face, and the better your chances of a full, healthy life. Let's start with a symptom most men brush off until it's far too late. Let's start with something most men shrug off until it becomes the one symptom they wish they'd never ignored. Persistent, unexplained pelvic pain. I'm not talking about the occasional twinge after lifting a heavy box or overdoing yard work. This is a deep, nagging ache that lingers for weeks, sometimes radiating into your lower back, your groin, or even down into your thighs. You rest, you stretch, you pop painkillers, and it's still there, humming in the background like a low, relentless engine. Here's why this matters. Your prostate sits at a crossroads of nerves, lymph nodes, and blood vessels. When abnormal cells begin to grow, or when intense inflammation takes hold, that pressure sends pain signals you can't wish away. The problem, it's so easy to blame on getting older, sleeping wrong, or a pulled muscle. Meanwhile, those abnormal cells could be gaining ground every single day. And here's the part no one tells you by the time pelvic pain is constant. It may already be your prostate's loudest cry for help. If that pain lasts more than 2 weeks without a clear cause, you need to track it. Note the time of day, the intensity on a 1 to 10 scale, and any activities that make it worse or give temporary relief. Pair that with any other signs like a weaker stream, increased urgency, or blood in your urine and take it straight to your doctor. This isn't overreacting. This is taking control before the problem takes control of you. Because when you catch this early, you open the door to simpler treatments, less invasive procedures, and a far higher chance of staying cancer-free. But pelvic pain is only one piece of the puzzle, and the next sign is something many men see with their own eyes, but convince themselves to ignore until it's too late. If pelvic pain is your body's loud cry for help, then this next sign is its silent sabotage, one that can quietly steal both your health and your confidence. Sudden, unexplained erectile dysfunction. We're not talking about the occasional off night after a long day. This is when the switch that once worked without a second thought suddenly doesn't. And here's the truth. Most men never hear those same blood vessels and nerves that power an erection run right past your prostate. When the gland becomes inflamed, enlarged, or seeded with microscopic tumors, it can choke off both the blood flow and the nerve signals, turning a reliable reaction into a frustrating blank. The dangerous part. Too many men write it off as stress, guilt, age, or even relationship tension. They buy over-the-counter pills. They avoid intimacy. They tell themselves it's temporary. But behind the curtain, the real culprit could be your prostate, and every month you ignore it. The clock is ticking on your options. Studies show a high number of men diagnosed with prostate cancer remember experiencing unexplained ED in the months or even years before their diagnosis. That means every unexpected failure is not just a bedroom problem. It's potentially your first warning shot. If this happens to you, rule out the obvious causes: medications, alcohol, unmanaged diabetes. If none fit, start a record. How sudden was the change? Are you also noticing pelvic pressure, lower back pain, or increased nighttime bathroom trips? Those patterns matter, and bringing them to your doctor could mean the difference between a simple treatment plan and a late-stage fight. Because here's the thing, addressing ED isn't just about regaining intimacy, it's about protecting your life. And while this symptom is one you feel in the most personal way, the next one is one you can see, and it can turn fear into action the very moment it appears. If erectile dysfunction is a warning you feel in the most private part of your life, this next sign is one you can see, and it can stop you in your tracks the moment it appears. Blood in your urine or semen, that faint pink swirl in the toilet bowl, that tiny streak where it doesn't belong, it can send a chill down any man's spine, and for good reason. While blood can sometimes be caused by a harmless infection, kidney stones, or even intense physical activity, when it appears without explanation or worse, when it comes back again, it demands immediate action. Here's why. As your prostate enlarges, becomes inflamed, or develops abnormal growths, fragile blood vessels nearby can break. Even microscopic tumors can disturb those vessels, leaking blood into the urinary tract or reproductive fluids. And don't make the mistake most men do thinking, it went away, so it's fine. Even painless blood is a diagnostic goldmine, and ignoring it could mean letting something dangerous grow in silence. If you ever spot it, document everything: the color, the time of day, and any other symptoms. Was there burning? Was your stream weaker? Any pelvic or lower back pain? The more complete your notes, the faster your doctor can order the right imaging or lab work to uncover what's going on. This could be your only early warning before a condition escalates into something life-changing. The truth is, you only get one first chance to catch it early. Don't waste it. And while this sign is visual and unmistakable, the next one is trickier because it hides in plain sight, masked as something almost every man blames on aging or a bad night's sleep. If blood is the sign you can't unsee, this next warning is the one you can't seem to escape no matter how much you stretch, rest, or tell yourself it's nothing. Persistent pain in your lower back, hips, or pelvis. It starts as a dull ache, the kind you blame on sleeping wrong or pushing yourself too hard in the yard. But weeks pass. The pain doesn't fade. Sometimes it even deepens, like a bruise you can't touch, radiating through your hips or settling into a constant pressure in your pelvis. The reason your prostate sits tucked beneath the bladder, surrounded by a tight network of nerves, muscles, and bones. When it becomes inflamed, enlarged, or develops early tumors, it can press on those nerves and send pain signals far from the source. The tricky part is that it mimics muscle strain or arthritis. So most men pop a painkiller, wait it out, and keep going while the real problem quietly advances. Here's the smart move. Pay attention to patterns. Is the discomfort steady for more than 2 weeks? Does it flare after long periods of sitting but ease when you stand? Does it pair with other signs we've already covered, like weak flow, nocturnal urgency, or even traces of blood? Tracking these details turns a vague complaint into hard evidence your doctor can act on fast, potentially triggering imaging or PSA testing before the situation escalates. Ignoring pain that refuses to leave is like turning down the volume on a fire alarm instead of putting out the fire. And if this ache is your body's way of asking for attention, the next sign is even more disruptive because it doesn't just change your comfort level. It hijacks your nights and drains your energy before you even realize what's happening. If lingering pain can wear you down during the day, this next sign can rob you of the one thing your body can't recover without quality sleep. Waking up once, twice, even 3 times a night to urinate. At first, and you tell yourself it's just age, or maybe that extra glass of water before bed, but then it becomes routine. You're up at 1 a.m., again at 3 sometimes before dawn, And each time your bladder feels full, yet you pass only a few drops. That's not just poor sleep, that's your prostate trying to get your attention. When the prostate begins to enlarge or swell from inflammation, it presses against the bladder and urethra. That constant pressure tricks your bladder into thinking it's full, even when it's not. The result? Sudden, frustrating urges, especially at night, breaking your deep sleep cycle and leaving you exhausted the next day. The danger isn't just fatigue. Nighttime trips increase your risk of falls, weaken your immune system, and over time, can throw your entire body out of balance. Most men shrug this off as normal aging. But if you're waking up regularly, it's time to track it. Write down how many times you go after 9 mm. Whether you're passing a large volume or just a trickle, and whether there's discomfort or urgency, those details can reveal if the root cause is your prostate, your bladder, or something else entirely. Because your body doesn't wake you up for no reason. And if this symptom is the one breaking your nights, the next one is the one breaking your momentum, slowing you down in ways you might not even connect to your prostate until it's too late. If nighttime bathroom trips are chipping away at your rest, this next sign is like a slow leak in your daily energy, weak or interrupted urine flow. You stand there waiting for the stream to start. When it finally does, it's hesitant, dribbling, or stopping mid-flow like a faucet sputtering with air in the line. You might even have to push or strain to keep it going. It's frustrating, sure, but more importantly, it's a clear signal that something is disrupting the plumbing inside your body. Picture your prostate as a ring wrapped around your urethra, the narrow tube that carries urine out. When that ring swells from inflammation, benign growth, or early cancerous changes, it squeezes the tube tighter. That means your bladder has to fight against constant back pressure just to empty. Over time, this battle can weaken the bladder muscle itself, setting you up for infections, stones, or even a complete blockage that lands you in the ER. So how do you know when slow is too slow? Time yourself. A healthy bladder can empty 8 to 12 ounces in about 20 to 30 seconds. If you're taking longer, starting and stopping, or leaving with the feeling you didn't finish, log it. Keep track for a week morning, afternoon, and night, and bring that record to your doctor. It turns guesswork into data and opens the door to early, minimally invasive solutions instead of emergency interventions, because the longer you ignore a squeezing prostate, the narrower your options become. And if this symptom is your body's way of slowing you down, the next one is far more direct. It doesn't just inconvenience you. It raises the risk of serious infection and sends an unmistakable red flag straight to your health. If a weak, stop-and-go stream is a sign your plumbing is under pressure, this next warning is what happens when that pressure tips the balance: frequent urinary tract infections or trouble fully emptying your bladder. Most men think a UTI is a women's problem, but when it hits you once, twice, or even 3 times in a single year, it's a sign your prostate may be creating the perfect breeding ground for bacteria. Here's why: when an enlarged or inflamed prostate blocks the flow, urine lingers in the bladder, and when it sits there, it becomes a stagnant pool exactly where bacteria thrive. You might feel a burning sensation when you go. Your urine might look cloudy, smell strong, or you might constantly feel like you need to go, even if nothing comes out. Over time, these repeat infections don't just cause discomfort, they can inflame the prostate even more, fueling a dangerous cycle that's harder to break the longer it goes on. The fix starts with awareness. Keep track of how often it happens, how severe it feels, and whether it pairs with other signs we've covered: weak flow, urgency, pelvic pain. That log gives your doctor the roadmap to pinpoint the cause and treat it before it spirals into something more serious like a full urinary blockage or advanced prostate disease. Because here's the truth: when you can connect the dots early, you keep control of the whole picture. And while this may be the last sign on our list, it's the first step toward understanding that prostate health isn't about fear. It's about using these warnings to act before the problem owns you. Your prostate doesn't just affect one part of your body, it impacts your comfort, your confidence, and your quality of life. The signs we've covered today aren't here to scare you. They're here to give you power. Power to notice the small changes before they become big problems. Power to talk openly with your doctor. Power to protect your future. Here's my advice. Don't wait until symptoms control you. Keep a simple log on your phone of any changes in your stream, your comfort, or your energy. Schedule regular checkups and PSA screenings, especially if you're over 50 or have a family history of prostate disease. Stay active, eat a balanced diet, and manage stress because your daily choices add up to years of better health. And remember, you're not alone in this. Every man deserves the chance to live free from fear, armed with the right information. That's why I share these tips, and why I want you to have them at your fingertips. So save this video now, so you can revisit it whenever you need a reminder. Share it with your father, your brother, your friends, any man you care about. And most importantly, hit that subscribe button and turn on notifications so you never miss the latest doctor-backed health insights for protecting your prostate and living your strongest life. Because knowledge is power, and when it comes to your health, the right knowledge at the right time can change everything.